Good afternoon, everyone. Welcome. My name is Amber Johnstone, and I work with the ALS Association in our Mid-Atlantic Territory. I want to thank you all for joining us for Day 4 of ALS Clinical Research Week. A few housekeeping items I want you to know before we begin. We will have time at the end of the webinar for questions. You can type your questions at any time throughout the webinar, and we'll review them to have them answered at the end of the webinar. You should see a Q&A option on your screen, and that's where you can type in your questions. You can also submit your questions in our chat box, and again, we'll review them at the end of the presentation. We do have a short survey that will pop up on your screen at the end of the webinar once the browser closes, and this survey helps us to know your thoughts and get ideas for future webinars. For those of you that are joining us for the first time this week, ALS Clinical Research Week has featured a webinar every day at 3 p.m. Eastern Time. Each webinar has focused on an aspect of ALS research, and today's webinar, we'll be learning about two current research programs: the CDC ALS National Registry and the ALS Focus Survey Program. Both of these are research programs that you can participate from right from the comfort of your home. And joining us today to present will be Patricia Stanko, Amanda Lee, and Ron Ferretra. Patricia Stanko has been with the ALS Association since 2010 and previously worked in care services and advocacy in Florida. She's been on the research team since 2022 as Associate Director of Mission Engagement. In this role, she works on programs to increase awareness of the National ALS Registry. Amanda Lee is joining us all the way from sunny Arizona today. And Amanda joined the ALS Association in 2022 in the role of Associate Director of the ALS Focus Survey Program. In this role, she works behind the scenes to help run ALS Focus. This includes designing the surveys, facilitating committees, maintaining the database, and raising awareness. She has a master's degree in public health and anthropology. And finally, we have Ron Ferretra, who is the chairman of the ALS Focus Patient and Caregiver Advisory Committee. In that role, he assists with the development of the ALS Focus surveys. He's on the Mid-Atlantic Advisory Council and the South Carolina Advisory Council. Ron's also a veteran. He retired as U.S. Air Force Chief Master Sergeant in 1995 and worked as a financial director for the city of Goose Creek until 2017. Ron is a person living with ALS and was diagnosed in October of 2016. All right, I'll hand it over to the team to present.
Thank you so much, Amber. So I'm going to share my screen and start. Ron and I are going to talk about the National ALS Registry to begin with, and then we'll hand it over to Amanda. So let me share my screen. So first, I just want to thank everyone for taking this time to meet with us today and to learn a little bit more about how you can make a very meaningful and valuable contribution to ALS research from home. And I'll start by talking about the National ALS Registry and going over exactly what it is and why it matters to count the number of people who have ALS, why it matters to collect data on what people's life experiences have been, what they've been exposed to, and how that information could be used ultimately to find better treatments or a cure or even to prevent ALS. These are the priorities of the National ALS Registry. So let's go back to the beginning in 2008 when the Centers for Disease Control and Prevention, or CDC, was mandated by Congress to create the National ALS Registry. And a registry is just a term to describe a specialized database for a particular disease or health condition. And it's designed to help researchers understand, get a better understanding of the particular disease. 2 years later, the registry was launched, and it included a web portal system where people living with ALS could go and sign up to confirm their case and also to answer some risk factor survey questions. And then in 2013, the biorepository was launched, and we'll talk in more detail about exactly what that is. So the goals of the registry are to find out what causes ALS, learn about the risk factors for ALS, and to report on the number of cases in the US. So Ron, I want to ask you, when you were diagnosed with ALS, why was it important to you and why did you join the National ALS Registry? Don't forget to unmute.
Read that all the time. Sorry. I joined the registry mainly because the most frustrating thing about having ALS is the fact that it takes usually about a year to diagnose ALS because it's a rule out disease. It rules out everything else you could have, and then they say, oh, you have ALS. So in joining the registry, my goal, one of the things I wanted was to provide some blood to them so that they could do some research, or that others could do the research, and so that we could get a good count on the number of people in the ALS registry that have ALS in this country.
Mhm.
Unfortunately, the 30,000 or 33,000, depending on where you look, is really only a guesstimate because it's not a reportable disease like cancer. Cancer's reportable, and they can tell you exactly how many people have it. We don't have that with a registry. In fact, even though it's started in 2010, so it's about 15 years old, there's only 1,721 people in the registry, which to me is kind of disgusting because I know that there's more people with ALS than that.
Thank you, Ron. Those are very, very good points. So to tell you a little bit more about the components of the registry, I want to go over what is exactly in there. So a person with ALS would start by going to the CDC website at cdc.gov/ALS. And then after answering a few screening questions and completing informed consent, you can create an account. And the first thing we recommend that people do is look at the risk factor surveys. So these are questions that ask about someone's life experience, demographics, work and residential history, exposure to toxins, and other possible factors that may have played a role in developing ALS, such as military service, sports, hobbies, head injuries, and other factors. And then people are also invited to learn about the biorepository, which we'll talk about in more detail. And they can also sign up to get clinical trial alerts so that when researchers are recruiting participants for new trials, you can be alerted that that's happening. Now, this isn't a clinical trial match program, and it's not individualized assistance like the My Tomorrows program we talked about on Monday, but it is a way to learn about what studies are recruiting new participants. And it might not be a match for your geographic area, but it's a way to cast a broad net, so to speak. And lastly, the CDC National ALS Registry also funds environmental research. In fact, it's the largest federal funder of research that's looking specifically at the connection to the environment and how that might be tied to the development of ALS. I want to point out that one of the risk factor survey questions is open-ended. It says, what do you think about, what are we missing? What is the CDC not asking about? What factors should we be looking at? What might have contributed to your own diagnosis of ALS, or that you think might be a contributing factor to the diagnosis of others? This is an important aspect of the registry, which ensures that they're listening to the community and integrating feedback from participants to add and edit or change the types of questions that are asked. So, Ron, if you were answering that open-ended question today, would you have this particular comment that you would want the registry to know about what you think might have contributed to your onset?
I do. I was an aircrew member for 21 of my years in the Air Force. I have about 9,000 flying hours, and I sucked a lot of JP4 or kerosene. Um, all aviation fuel is nothing more than refined kerosene. Diesel fuel is nothing more than refined kerosene. And the military has a higher incidence rate than any other career field, if you will. And we all work with the same stuff. Virtually all the military vehicles, other than cars, are run by diesel fuel. And in my personal opinion is that that's what triggered my ALS. ALS. Here at Charleston, we had 7 of us serving at Charleston at the same time, all crew members we were there over about a 5 or 6 year period together. There's 7 of us that have ALS. 6 have died. One of them was General Mikolajczak, who actually was instrumental in developing the registry and getting ALS designated as a service-connected disease.
Wow, that's incredible. Thank you for sharing that. I hope that gives a good example of thinking about some things that maybe people in the audience today might want to share with the CDC about their own experiences. I mentioned before I wanted to take a minute to talk about the biorepository, and Ron mentioned that as well. So how it works is what goes into the biorepository are collections that are taken from the home environment. So a person would opt in to receive a packet of information that would be sent in the mail. It would include an informed consent form, and the biorepository would contact the person with ALS or the caregiver to make sure that all of the questions have been answered. And if everybody agrees, then they would schedule someone to come to the home or to another location of your choosing to collect a blood sample. Now they collect whatever the researchers are asking for. So in the past, they've collected urine and saliva and fingernail clippings and things like that. But what the researchers are really asking for is blood. So that's what they're collecting. And here's the thing, they're not just putting that into the biorepository. Also, what's going into the biorepository are the de-identified risk factor survey questions that someone might have answered. So if a person has also completed those risk factor surveys, the researcher is not just getting the blood of an ALS patient, they're getting the blood of someone living with ALS who has a particular risk factor profile. Why is this important? We know that ALS is not a heterogeneous disease. It's not one disease. It's a family of related diseases. People have different genetic aspects to the disease. There's different onsets, different progressions. How are those diseases different with what's going on physiologically in the body versus how it's presenting as symptoms progression? So this is what's going to help the researchers to distinguish from those different types, and also to create more individualized and targeted treatments in the future. And I also just want to make sure that you know that there's also postmortem tissues that are available for the researchers, and that when those samples and data goes out, it's not available to anybody. It's not public. There has to be a request process, and there's some vetting that happens, and it's only people who are vetted to be legitimate researchers who have a reviewed ethical research protocol with some sound science behind it. Those are the researchers that are going to have access to the samples. So by staying home and signing onto the internet on a computer or a device and joining the registry, it may potentially look like a person with ALS has joined a research study. Okay, you signed up for the registry, you answered the risk factor questions. Maybe you considered donating a sample to the biorepository. Check, you're done. Yeah, you did that. You did the one research study and you can check it off your list. But your de-identified secure data and your sample are not done, not by a long shot. Your risk factor surveys, disease progression information, demographics, if you join the biorepository as well, your blood sample, those are all available to researchers on an ongoing basis to help them solve the puzzle of ALS. So in theory, you could be making a contribution to dozens, if not hundreds, of research studies going forward. And these are just some examples here of institutions and organizations that have utilized samples from the biorepository. On the right are the logos of those organizations. And then there's just a sampling of over 120 of the published journal articles that are all archived up on the CDC Registry's website. So if I've convinced you to consider giving this a try, how would you set up for success? So first thing is to set up an account and get that part done. It's 10 or 15 minutes. It's definitely okay to have a helper, have a family member, someone who's internet savvy or is comfortable with computers or can help you to get this done. And it's important to get into the right mindset. Some of these questions are very detailed and it can be kind of taxing. So you'd want to try and do this at a time of day when you have the best energy, and maybe set up a little reward to give yourself when it's done. It always helps to make an appointment with yourself or someone else. If you haven't been on the National ALS Registry's website yet, or if you haven't been on it lately, they've done a reorganization, so please take a look. Here are some key aspects to take a look at. Right here is where you would go to create a new account if you haven't done that already. This is where you would log into an existing account. This is where the National ALS Registry dashboard exists, which has a bunch of infographics that talk about the statistics that they're calculating. And this is a list of the clinical trial studies that have utilized the registry to recruit participants. There's also a full version in Spanish that can be found at this address, cdc.gov/ELA. And just a few additional details. It does ask for the last 5 digits of a social security number. That's just mostly to confirm a case. So the registry not only has people coming in through the web portal, they also are collecting administrative records from Medicare, Medicaid, and the VA. And so by asking for the last 5 digits of a social security number, they can make sure that they're, number one, confirming that case, and also make sure that they're not duplicating a count. As I mentioned, you can opt in to get the clinical trial alerts or have the registry communicate with you. Sometimes we hear things from people like, I signed up for the registry, but I never hear from them. It's like they don't even know I exist anymore. I mean, it's like they forgot about me. If you don't opt in to let them communicate with you, they will respect that. So just a reminder about that. Some of the other research studies that have been discussed earlier in the week talked about ALS versus PLS, or primary lateral sclerosis. And with the registry, a diagnosis of ALS is required and people with PLS are not eligible at this time. Sometimes we hear from family members, my loved one meant to sign up for the registry, but they didn't do it. And sadly, they've passed away, but we have all the information and we can contribute it. But because informed consent is required, that's not allowed. And we understand that there's a lot of competing demands on time and energy when it comes to ALS. It's an overwhelming diagnosis, and we really do understand that. It is okay to ask for help. And if you need help, we do have a new volunteer program that can either just help get you started, help you figure out if you have an account, if you're not sure. Maybe you started the risk factor surveys, but you didn't finish them, and the volunteer can meet with you virtually to get those done. Or the volunteer can help guide you through the entire process, whatever you need. So if you're interested in learning more about that, you can reach out by email to registryinfo@als.org, or you can call or text 202-464-80 888-888-5845. So Ron, we're coming to the end of our time to talk about the registry. And I just want to ask you, what are your thoughts for the people in the audience today, or people who might be listening to a recording of this webinar? What would you want to say to them about joining the National ALS Registry?
Well, the first thing I'd want to say to them is if you haven't joined, join. That's one of the most important things you can do. When we ask for things, when we ask Congress for money to do anything, one of the things that some of them ask is, how many people are we talking about? And we tell them, oh, well, we think. And that turns off some people. So that's one of the reasons why you should register. The other reason why you should register is because they need all of this stuff to help find a way to slow down your ALS and then to stop it. Because every person I know with ALS, if they could take a drug tomorrow and it would leave it right where it is in their body, it would never get any worse than you have it that day, they'd be in ecstasy, because we've learned to live with it at whatever point we are. And if they could just stop it and then find a cure. So the registry is important. One of the things that's also important is to enrolling in the donation of your brain and your spinal cord when you pass. That's very significant stuff that they can use in research. If you're a veteran, there's a veteran brain bank, that you can register through. It's real easy. You fill out some paperwork, you sign a release, and they send you a card to give to your loved ones to say, call this number, and they take it from there.
Well said. Great advice and great call to action. Thank you, Ron. So now I'm going to turn it over to my colleague, Amanda Lee, and she and Ron will talk about the ALS Association's Focus Survey Program, another research project that you can participate in from home. Amanda? I'll stop you.
Thank you so much, Patty. And then I'm also going to have some slides. Here we are. So thanks for having me here today, and Patty and Ron as well. We're going to be talking about the ALS Focus Survey Program, why it's important, and the impact that it's having. And we're hoping that after listening to this, you'll be excited to sign up, not just for CDC Registry, but also ALS Focus. And so you can start participating in research right away from the comfort of your home. ALS Focus is an online research study from the ALS Association that asks people with ALS and caregivers about their needs, opinions, and challenges. ALS Focus surveys happen twice a year on different research topics. Those topics can include clinical trial preferences, caregiver needs, insurance challenges, and experiences with mobility equipment, and many other things. Our goal is to learn as much as possible about individual experiences throughout the ALS disease journey in order to amplify those experiences and bring them to the forefront of ALS research, advocacy, and care. People with ALS, current caregivers, and past caregivers are all eligible to participate in ALS focus surveys, and you can have a proxy respond on your behalf if you request that. Participants just need to be 18 years old or over and live in the United States, and all of our surveys are in English and conducted online. There are some unique aspects of ALS focus research. One is that this research is really driven by people with ALS and caregivers who participate in our Patient and Caregiver Advisory Committee, which we call the PCAC. Ron is a co-chair on the PCAC and has been part of Focus since it began. The PCAC provides strategic input for for the focus program, such as selecting our research topics, designing and reviewing questions, testing the surveys for accessibility, and recruiting participants to join the study. The PCAC helps the program stay grounded in issues that are pressing to members of the ALS community. We also have partners from academic universities, federal government, and industry who bring their expertise to the program as well. And Ron, I wanted you to take a moment to talk a little bit, if you could, about your experience as co-chair of the ALS Focus PCAC.
The focus has really changed. When we first started doing surveys, the surveys were, I don't want to say mundane because Amanda will make a face at me, but they really were. We weren't getting into what was needed, and we have since changed. One of the biggest changes was we started looking at the equipment that was provided to the people with ALS and what they needed. And some of the results, Medicare just started approving lifts on wheelchairs, or the razors, 17-inch razors on your wheelchair so that you can get up to eye level with someone. That just changed. I think it was a year and a half ago. Part of that change, they used some of our survey data. So the surveys are very important. One of the things we talked about is if you get a wheelchair, that's wonderful. But if you have steps to go into your house, then we just put you in a nice wheelchair in your own jail. So we did a survey to talk about how to get out of the house. You need ramps and ways to do it. So that to me has been the great part of Focus, is the awareness that we've presented to the world on what is really needed.
Thank you, Ron. Yeah, that's very well said. The data from our focus surveys inform programs and policies, not just at the association, but also in federal government, state government, and clinical trials, all sorts of different areas of ALS care and research. So by sharing our focus survey results far and wide, we hope to continue influencing and expanding things like patient-focused drug development, telehealth policies, equipment programs like Ron mentioned, and so much more. De-identified focus data files are available for the public and for ALS researchers to use for free. By making our data publicly available, we're fostering open science, which we know is crucial for diseases like ALS. Researchers can analyze focus data by different factors, such as the region of the US that someone's in, their demographic information, or their ALS disease status. We want this data to expand the possibilities for ALS, for discovery and ALS research, and to serve ALS advocacy and care. Survey results and our data files from previous surveys can be viewed on our website at alsfocus.org. The data we collect is all kept secure and confidential. An outside committee called an institutional review board oversees our program to make sure our standards for protecting people's information are rigorous. Each participant receives a unique neurostamp, which is just a code they're assigned that ensures the data is de-identified. And that means your name and your personal information are never attached to your survey responses. We need you to participate in Focus to ensure that we're collecting data that is representative of the entire ALS community. If we're only getting surveys from one part of the country, then we might be missing out on where you are. So only you can share about your individual experience with ALS. And we want to bring those experiences forward to the center of all conversations about ALS. The more people we can get registered for Focus, the more responsive, accurate, and influential our research can be. This is an avenue for people to share their needs and perspectives in ways that have a big impact on advocacy efforts, care services programs, clinical trials, and so forth. Ron, can you talk just a bit about what makes Focus important to you, and why you think people should join?
I think people should join Focus mainly because of the information we provide out there. At any given point in time, there is about 700 research projects going on throughout the world. These research projects use not only their info, but ours. And they share info. All these places that collect your stuff share it. ALS TDI, which is a research program, shares it. The ALS Association does. The um, 1 million veteran program that the military has shares that stuff. And that's what makes our information so valuable, because our information doesn't just take blood, it takes what really goes on in your life. I've often said to a lot of different people many times, if you don't have ALS, you really don't know what ALS is. And that's what's the most important thing, I think, about ALS Focus, is that all of us that have ALS that are in Focus, we know what it is. And that's why I think everyone with ALS should sign up for the Focus program. You don't have to give any blood, you don't get stuck. You answer a few surveys, and then uh, you can, even if you want, help us build surveys.
Thanks, Ron. Yeah, sharing information ethically with other researchers with the consent of participants is really important to us because it just leads to further collaboration in these spaces. So we need your help spreading the word about ALS Focus to reach more and more people living with ALS. You can share our information through email or social media, or reach out to us to get flyers for ALS clinics and events. How can you participate in ALS Focus? We want to get you signed up as soon as possible. It's very simple and easy to register, and we've worked hard to make our survey platform as accessible as possible for people using different types of devices. First, you go to alsfocus.org and you click on the big red button on that screen that says Register for ALS Focus. That'll take you to our survey platform called Qualtrics. You'll follow the instructions and answer a few questions from there. Invitations to take focus surveys will start going immediately to your email inbox, and you'll get invited to new surveys when they open. We try really hard to limit the emails we send you so you're not getting overloaded, and we try to send only things that are relevant to taking ALS focus surveys. This QR code will take you to the website. And again, any person with ALS or past or current caregiver over 18 and living in the US is eligible for this. If you can't remember whether you've registered in the past or not, you can still go to alsfocus.org and fill out the form, and you'll get an email that tells you if you're up to date or not. Since ALS Focus started in 2020, we have fielded a dozen different surveys, and over 3,600 people have participated in at least one of these surveys, making it one of the largest social science studies in the ALS community. Over the past 5 years, we've run each of these surveys listed here, and we've built up our database of registered Focus members. A new survey opens each fall and spring and typically remains open for about 2 months. PCAC members like Ron have the opportunity to directly share opinions about what topics should be covered and to review and test the surveys before they're launched. Focus members are emailed whenever a new survey opens, but you can register for Focus at any time of year. And in March, we're going to be launching a new survey on social connection and quality of life. Ron, I just wanted to take a moment and see if you had anything you wanted to add about the topic of social connection, and why we want to be looking at that with this survey. You're on mute right now, just so you know. Ron?
I always do that, sorry.
No
One of the
problem.
things that happens when anyone first gets diagnosed with ALS is they're kind of shocked. So that leads to one of two things happening. Either the person becomes a hermit, or the person gets pissed off and becomes an advocate. obviously, I believe that you should become an advocate. To do that, you have to socialize. You can't just sit at home and watch TV or sit at home and play with your telephone or your computer. You really need to go out there and to socialize, whether it's getting with a group of people at a swimming pool or at a center where you all just sit around and play cards or whatever, but some kind of social setting where you're talking to people. Because when you do that, you're letting other people know about what ALS really is. It's like I said earlier, if you don't have ALS, you don't know what it is. And there's a ton of people out there that when you say, I have ALS, they go, what's that? Oh, what are they going to give you to cure that? Well, A, it's Lou Gehrig's disease. Most people know it by that. And there's nothing they can give us to cure it. So get out there and get social. And that's what we want to drive in that survey, is to find out who's getting social, and then hopefully we can find out why they're not, if they aren't.
Yeah, thanks, Ron. So in that survey, we're going to be asking about all different types of social interactions, both online and in person, and to get a sense of how that's impacting your life. So if you register for Focus now, you'll be notified as soon as that survey opens. I don't have a lot of time, but I'm going to very quickly go through some preliminary results from our spring 2024 survey on clinical trials and treatment needs, since it's Clinical Trial Research Week. And I want to do this quickly because I want to answer your questions. So in this survey last spring, we asked people about two different topics on clinical trials and treatment needs. In the treatment needs part of this survey, we measured what do people in the ALS community want future drug treatments to target. Data on treatment priorities from our focus research can help inform what's called patient-focused drug development. In the survey, 834 people with ALS and proxies and 263 current and past caregivers responded to the survey on measuring treatment priorities, which is a total of 1,097. And at least one person from every state in the United States, except Hawaii, participated. You don't need to look at these graphs too hard. I'm just going to walk quickly through them. Participants were asked about their top treatment priorities. And this question we asked, when thinking about drugs for ALS that might be developed in the future, which of the following are most important to target? Please indicate your top 3 priorities. And then the participants were given a list of 9 different symptoms to choose from, which included breathing, speaking, swallowing, salivation, digestion, cognitive function, and lower and upper body strength. And you can see in the graphs here that participants who answered this question most frequently chose breathing ability as their first priority for drug treatments, swallowing ability as their second priority, and speaking ability as their third priority. And this pattern was the same for people with ALS in red and caregivers in blue. Participants were also asked to write in their response to the question, are there other symptoms of ALS that you would like to see addressed by future drug treatments apart from what was already included in the prior question? This open-ended question was intended to capture any important ALS symptoms that were not included in that priority question. Over 300 participants wrote in at least one other symptom that they'd like to see addressed, and those are shown here on the left. And some of the most frequently mentioned symptoms included involuntary muscle movements, general ability to move and balance. And a striking result is that caregivers wrote in mental health most often as a treatment priority. So the results of the survey emphasize breathing, speaking, and swallowing as important directions to pursue with future treatments for ALS. Caregivers also lifted up mental health as a priority. This is an example of how large-scale data can amplify community perspectives and infuse those perspectives into drug development and strategies that make ALS livable. We're still analyzing this data, and some of the results were shared at a presentation at the International Alliance meeting last month. The results will be posted on our website within the next few months, and we hope to publish a manuscript on the results this year. For time, I'm just going to quickly skim through this. There are many things we've learned from our past surveys. These are a handful of things, but there are so many more. Something we learned is that 1 out of 4 people with ALS and caregivers have experienced debt or had to borrow money due to ALS treatment or caregiving. Another thing we learned is that 1 in 3 people who had submitted a prior authorization or claim to their insurance for ALS care had been denied before, and prescription medications or medication supplies were the most commonly denied by insurance companies. So maybe some of those findings reflect your own experiences too. With the focus surveys, we have the numbers and data to take action on these pressing issues. And I'll just talk briefly about how we've been taking action. What have we been able to do with ALS focus data from our surveys in the past few years? And these are just a few examples. In the past couple of years, the ALS Association submitted focus data on Power C elevation in public comments to the Centers for Medicare and Medicaid Services, as Ron mentioned, when they were assessing evidence on the medical necessity of Power C elevation, which we know is very important. They ultimately decided to cover the cost of Power C elevation. This was a big win for the ALS community, and we're really proud to have submitted our focus data as part of the evidence they considered. And last year, all of our focus survey results and our public data files were provided to the National Academies of Sciences, Engineering, and Medicine Committee for their study on accelerating treatments and improving quality of life in ALS. So that's an example of how we're collaborating with other research initiatives. There are so many more examples. I don't have time to go through them all. I wish I did. But just our team continues to really engage with researchers at conferences and through partnerships to leverage the focus data that you provide and make a big impact on care, research, and advocacy. So finally, we just thought it would be good to clarify some similarities and differences between ALS Focus and the National CDC ALS Registry that you heard about. ALS Focus and the CDC Registry, they both involve surveys that ask about your life experiences. They both report data anonymously, are IRB reviewed, and use neurostamps to de-identify participants. Some differences are that ALS Focus is open to ALS caregivers as well, while the registry is not open to caregivers right now. ALS Focus is run through the ALS Association and has new surveys on different topics throughout the year with the goal of capturing people's current needs and opinions. And the ALS Registry is run through the CDC, and it's focused on counting cases of ALS throughout the US and analyzing environmental risk factors. And for the most part, you only take the CDC registry surveys one time and then you're done. The registry also includes the biorepository that you heard about. Both programs are very important to participate in so researchers can understand more about ALS, both by looking back in the past and understanding your current situation now. Both of these programs can be done from your own home online. So thank you all for taking the time to hear about what we're doing with Focus. And again, we really encourage everyone who's eligible to register. There's power in numbers. So the more people we hear from through focus surveys, the more power our data can have. And I'll take just a quick moment to thank the many people who've dedicated time and resources to Focus, including our amazing advisory and steering committees, academic partners, industry sponsors, most importantly, our ALS Focus participants, and of course, Ron today for being a superstar and talking both about these two important programs. So now I think we have time for questions.
We do, yeah. So we've got about 15 minutes for questions, and we did get some good ones. If you haven't submitted your question yet and you have one that you'd like answered, please feel free to pop that in the chat or use the Q&A feature, and we'll answer as many questions as we're able to. One question, this one's for Amanda. Someone asked a question, why is it $40 a month to be a member of ALS Focus? Can you clarify if there's a cost associated with participating in ALS Focus?
Yeah, there's no cost at all to sign up for ALS Focus. So I don't know if maybe that's a different program that's being confused, but yeah, it's totally free to sign up for Focus. It shouldn't cost you any money. If anyone's asking you for money for Focus, you shouldn't give them the money.
Thank you. Okay. A couple of questions were asked about how information is shared. So a couple people asked about that they're participating in research through another agency. So one is asking specifically that they gave blood to ALS TDI, and another has given some samples to Healy platform. And so the question was, are samples and data from those programs shared with the CDC? Or do you also need to share your samples with the registry program?
That is a great question. And so for the Access for All ALS Consortium, they are working to coordinate because, yeah, it doesn't make sense for one person to have to go to multiple samples and give multiple research and then have being asked the same question again and again and again and again. So when Access for All ALS Consortium was created, there definitely was weigh-in from the registry. Like, if you're going to ask about risk factor survey questions, let's ask them in the same way that we ask them so that we can correlate that data. So I know that it's not all perfectly coordinated at this time, but that is something that all of the partners that work on this, ALS TDI, the registry, Answer ALS, Target ALS, NEALS, Create, all of those consortiums are working towards better collaboration and coordination.
Thank you, Patty. We love to hear that everyone's working together. Another question asked if I've registered with the ALS Association. Have I completed the registry? And Patty, can you talk a little bit about how those things are separate?
Yeah, unfortunately, so it gets confusing because, like, sometimes we'll ask someone, have you signed up with the National ALS Registry? And they'll say, well, I'm registered with your organization. The words sound the same, and so there can be some confusion. So the CDC National ALS Registry is voluntary. It is not something that happens automatically. It is something that you need to go to and be intentional and proactive about. So no, it's not something that happens automatically. You go to the website and you choose to set it up.
Thank you. Patty, you mentioned that you must have a diagnosis of ALS in order to participate in the ALS registry. Are you aware of any programs that are out there that are collecting information on other diagnoses that may fall under the spectrum of upper motor or motor neuron disease?
I will have to think about that and I'm not sure. Nothing comes to mind at the top of my head, but there may be, so I'd have to think about that for a minute.
Okay. A couple questions about whether or not you have to provide samples to the biorepository in order to participate in the registry.
Oh, no, that's not required. Nothing's required. So this is all voluntary, optional activities. You only participate if you want to. So I saw a couple of questions too from people who said that they signed up from the registry a while ago and they don't remember seeing anything about how to join the biorepository. They don't remember being offered the opportunity to join the biorepository. So Amanda, if I could just have you stop sharing your screen for 1 second, just in case there's interest in this. I just wanted to go ahead and share quickly, if I can do this here. Okay, I'm going to go like this, and here we go. So I do have this, and Ryan, I can get this to you, but to request information about the biorepository, you would go to your account and you would log into your dashboard. And once you get into your account, then you would click under the account settings, update account. And then when you go to update account, this is also where you can opt in to let the registry communicate with you, or if you have a change of email or a change of contact, or you want to reset your password, that's where all of this would happen. So scrolling down a ways, you would get to the section on the biorepository, which is here. And so you would, let me make it a little bit bigger because I have it kind of small, but you would agree that you want to either learn more about donating to the biorepository. It also, now the biorepository is not collecting postmortem samples, but they are partnering with other organizations who do, and they can guide you in that in terms of letting you know who they're working with. And, or you can ask to learn about both, and then you'd enter in where you want the information sent. Because it's not like you just submit this form and then someone shows up at your door with a needle. It's a process. And just remember to click update account. You have to click that down at the bottom, and then you should be all set.
Thanks, Patty. I know there was another question asking whether or not you need to register for postmortem specimens to be collected, and how you do that.
So again, Ron mentioned that there's, for veterans, there's a lot of options with the brain bank, and there are other partner organizations that are working with the registry to, it kind of depends on where you are and what's going to make the most sense for your particular situation to set that up in advance.
Thank you. Let me just scroll through and make sure we got our questions. And Amanda just popped up on the screen those QR codes for both programs. A couple of folks are asking questions about finding specific trials. And so definitely our resource, My Tomorrows, would be a great one for that. It's a personalized navigation service. Check you can look our website for that. Maybe Ryan, can you maybe pop a link in the chat for that as well?
For the recording from Monday, or for the My Tomorrow's program?
For My Tomorrow's, but there was a question,
Yes.
if the presentations are going to be shared at a later date.
Yes, I was going to hop on and address that. We have recorded these webinars, and we are hoping to get them uploaded, I believe, to our Care Services webinar page, but also the ALS Association YouTube channel. So they will be available to view afterwards. My hopes are to be able to send the links to not only the webinars, but not only the webinar recordings, but also some additional resources and links that are discussed in these presentations out to everybody in attendance, hopefully in the next week or so. So yes, all of that stuff, the plan is to get that all sent out to everybody in attendance and packaged up nicely for you guys.
ALS TDI has a research finder as part of its website. So if someone goes to ALS TDI, they can get to that research finder.
Thanks, Ron. Okay, Ryan, I think if you want to take a quick look through too, I think we've addressed majority of the questions, and Ryan just popped the My Tomorrow's navigation link in the chat as well.
Yeah. Yeah, just a couple that were sent to me directly that are real quick ones. For the focus survey, Amanda, maybe you've already answered this, so forgive me. I was typing a couple things. Can someone with PLS participate in the focus survey program, or must it be a diagnosis of ALS?
Unfortunately, it must be a diagnosis of ALS.
Okay. And another quick kind of practical question: if you are registered with the focus survey program, do I receive contact every time a new survey is being produced, or do I have to register every time?
You don't have to register every time. So you register once, then you start getting the surveys whenever a new one opens.
Okay, perfect. That's the only other questions I have.
Okay. Well, thank you so much, everyone, for joining us. And of course, thank you to Patricia, Amanda, and Ron for being willing to share some wonderful information with us. If you do have any questions that we weren't able to answer today live, you can email Ryan and he can get back to you. Ryan's email is ryan.t as in Tom, A, P as in Paul, P as in Paul, E @als.org. Hopefully you can join us again tomorrow for our final webinar of the week at 3 p.m. Tomorrow, we're going to be joined by ALS Association Vice President of Research, Dr. Kuldip Dave, and he'll be presenting on updates on ALS therapeutic landscape and the ALS Association's strategy to have more, better, and faster trials. And just a final reminder that when the webinar ends, automatically a little window is going to pop up on your screen for a survey, and that would be really helpful for us just to gather your thoughts and your feedback on how things went with this program and what we can do in the future. So I would like to say thank you again for attending, and I hope everybody has a wonderful afternoon.
Thank you, everybody.